Pneumonia is a respiratory infection in the lungs that causes inflammation and causes the lungs to fill with fluid and pus. Pneumonia develops when a pathogen reaches the alveoli and the host defense mechanisms are overwhelmed, causing overgrowth that leads to the pneumonia. The pathogens can include bacteria, fungi, and viruses. Alveoli are inside the lungs, and they are responsible for gas exchange. When they become filled with fluid or pus, they can't perform gas exchange adequately, leading to hypoxia and decreased oxygen and CO2. Pneumonia can be caused by a pathogen of bacteria, fungus, or a virus. The treatment is different for each pathogen causing the illness. Some common pathogens that can cause pneumonia are the COVID-19 virus, Streptococcus pneumoniae, as well as RSV. The common types of pneumonia include community-acquired, hospital-acquired, as well as healthcare-acquired, which is a little bit different, ventilator-associated, and aspiration pneumonia. Each one of these pneumonias have a different reason for development. Hospital-acquired pneumonia is classified as a pneumonia that is developing 48 hours after an admission to an acute care facility that did not show to be incubating on any images upon admission. The patients that are most at risk for hospital-acquired are post-op patients, those suffering from immobility, and those over 65 years old. Healthcare-acquired pneumonia is a little bit different, as these patients aren't hospitalized but are receiving some sort of treatment, such as in-home health care, dialysis treatments, that causes them to be exposed to some healthcare workers. Community-acquired pneumonia develops within the first 48 hours after hospitalization or was their admitting complaint coming into the ER. Ventilator-associated pneumonia occurs within 48 hours of being on mechanical ventilation. Aspiration pneumonia is caused by aspiration of gastric content or any other substance into the lungs. Patients with NG tubes or G tubes are at risk to aspirate. Some clinical manifestations you may see in the patient with pneumonia are fever, diaphoresis, chills, dyspnea, tachypnea, a productive cough, and a decreased oxygen saturation. The patient may, upon assessment, have crackles, wheezes, and rhonchi. When assessing a patient with pneumonia, it is important to listen to their lung sounds with your stethoscope, as well as use a pulse oximeter to check their oxygen level to ensure that it is between 92 and 100%. Patients with pneumonia may need supplemental oxygen. Some diagnostics for pneumonia include chest x-ray, which would show an infiltrate, an arterial blood gas, which could show hypoxia, as well as pulse oximeter monitoring for hypoxia, blood culture to see if any bacteria has gone into the bloodstream, a sputum culture to see what is growing, bacteria, fungal in the pneumonia. Routine blood work could show an increased white count, and your vital signs showing a temperature and increased respirations. Some important interventions with the patient with pneumonia to increase fluid intake to help loosen secretions, help them cough it up, cough and deep breathe, chest percussion, postural drainage. Make sure you raise the head of the bed to help them expand their lungs and breathe easier, and maintain an adequate calorie intake, as patients can lose weight because it's working harder to breathe. Sepsis is a life-threatening complication of pneumonia. As a nurse, you want to see if their heart rate is increasing and blood pressure is decreasing. This can be a sign of septic shock. Sepsis is life-threatening complication of pneumonia. It leads to septic shock. It's when the pathogen that was causing the pneumonia has now reached the bloodstream and is circulating throughout the body. Antibiotics should be started after 2 sets of blood cultures. Fluid resuscitation, prompt nursing intervention is needed. Acute respiratory distress syndrome is also a complication of pneumonia. It is when the patient remains hypoxic, although adequate oxygen therapy has been initiated. This often leads to mechanical ventilation for these patients. But in human flourishing, the treatment for patients with pneumonia, depending on the pathogen, typically bacterial antibiotics, if it's fungal, antifungal medicines, anti-inflammatory medicines such as NSAIDs and steroids, and bronchodilators. 2 blood cultures should be drawn prior to the initiation of an antibiotic. Then a broad-spectrum antibiotic should be administered while awaiting the blood culture results. Typically, fluoroquinolones such as levofloxacin and penicillin are started for pneumonia treatment. Cephalosporins are also indicated in the treatment of pneumonia. Kidney function tests should be monitored during the administration of IV antibiotics. Bronchodilators, inhalation should be used, like albuterol, to decrease inflammation in the airway, to stop bronchospasms, and just increase adequate ventilation. Steroids and NSAIDs are used to decrease the inflammation in the airway, decrease inflammation in the lungs, and help open the pathways. IV Solu-Medrol is frequently used in the treatment of pneumonia, as well as prednisone. Respiratory therapists play a huge role with pneumonia. They teach incentive spirometry, how to use a cappella, do chest physiotherapy, and administer nebs in the hospital. Some risk factors for developing pneumonia include cigarette smoking, COPD, immunosuppression, prolonged intubation, having an NG tube or a PEG tube puts you at risk for aspiration pneumonia, as well as being elderly over 65 or advanced age, and general anesthesia puts you also at risk for developing pneumonia. Some oxygen delivery devices for the patient with pneumonia include a nasal cannula, a non-rebreather mask, a Venturi mask, a CPAP or a BiPAP, and mechanical intubation. These ensure that the patient is receiving supplemental oxygen to keep their oxygen level adequate. Some prevention for pneumonia: avoid cigarette smoking. That causes COPD, can cause lung cancer, puts you at risk for developing pneumonia. Avoid occupational exposures like working in a mill or the coal mines, which can cause black lung, puts you at risk for developing pneumonia. And get vaccinated. There's currently 2 vaccinations for pneumonia. We'll talk about those. The PCV13 vaccine for pneumonia protects you against 13 different kinds of bacteria that can cause pneumonia. It is recommended for those 65 years and older or 19 and older if immunosuppressed. The PPSV23 vaccine for pneumonia protects you against 23 different kinds of bacteria that cause pneumonia. It is recommended in those that are 65 years and older, as well as 19 to 64-year-olds who smoke. These vaccines are able to be taken a year apart. If you've been vaccinated with the 13, it is recommended that you wait a year and then be vaccinated with PPSV23. Getting your yearly flu vaccine can also help prevent you from developing pneumonia. This is a nasal cannula, a BiPAP mask, endotracheal intubation, an incentive spirometer, and an acapella.